T. Raja. I'm the Director of Medical Oncology, Apollo Cancer Center in Chennai. I'm so thankful that you all came, and I'm so thankful that I could, introduce this topic to you. What we are announcing is that the successful launch of this program in our hospital. We have been treating patients with this new modality of treatment for the past 1 year. We started this in November 2022, but we wanted to make sure that the patients have done well over a period of time, and the 3 of our patients have already crossed 1 year, and so therefore we wanted to launch this program. Over, this is being used for patients with difficult to treat diseases in advanced setting and relapsed setting, where the expectations of their survival is not very high. In such patients, what we see is that 70 to 75% of them respond to this treatment, and out of that 40% of the patients achieve a complete response. And patients who achieve a complete response go on to live for a long time. They become the long-term survivors. Currently, it's an expensive treatment, but with the availability of Indian technology, I'm sure the cost will come down. Thank you. I'm honored to be here with you just to explain a little bit about what is this and what we are trying to do, CAR T cells. So you will have, all of you will have, some of you already have a lot of knowledge, because when I interacted with some of them, I was really impressed with the depth of knowledge that some of the questions came. But some of you may have some questions on what is CAR T cell therapy. Please listen to this video.
If it's working properly, the immune system wants to kill cancer cells. That's its job. Create an army of T cells to patrol our body for signs of infection and other diseases. The T cells inspect suspicious cells and, when they find an abnormal one, immediately lead an attack on it, while limiting the damage to healthy cells. The way they do that is pretty elegant. T cells have protein receptors on their surface, and these claw-like structures latch onto antigens, protein fragments found on the surface of all cells. When a receptor latches onto an abnormal antigen, like one found only on a diseased cell, the T cell turns on and releases toxic chemicals that damage the abnormal cell and recruit other immune helpers to the area. Sometimes cancer cells develop ways to fool the immune system, either by disguising themselves as healthy cells or by sprouting so many antigens on their surface that the T cells are stymied and can't mount an effective attack, or by finding ways to turn off the immune response against them. One innovative way to see through the deception is CAR T cell therapy. Thousands of a patient's own T cells are collected in a process similar to a blood donation, using a modified and inactive virus that can't cause any disease but can introduce genetic information into a cell. The T cells are reprogrammed so they now produce special receptors called chimeric antigen receptors, or CARs, on their surface. These newly engineered cells, called CAR T cells, are grown in a lab, and millions of them are infused back into the patient. The new receptors enable them to latch onto a specific antigen on the patient's tumor cells and destroy them.
Simply, it's an advanced form of immunotherapy. Patients' own T cells are taken and they are re-engineered. What happens is, in cancer, somehow our own immunity is not active for some reason. Cancer is able to easily evade them. But by re-engineering these T cells, we are trying to awaken its immune power and give it back to the patient. And then they will go and specifically act on the cancer cell. That's the whole concept of this. If it is from the patient, it is known as autologous CAR T cell. It can be also from healthy donors, then it is known as allogeneic CAR T cells. The beauty of it is that it is, coming together of, very, very exciting technology, engineering and biology coming together. Some call it as some advanced form of immunotherapy, but the scientists really call it as synthetic biology.
The director of oncology at the Apollo Cancer Centers, it is with great pride and a deep sense of responsibility that I welcome you to this defining moment in the evolution of cancer treatment. In an era marked by the increasing prevalence of cancer, our mission at Apollo has remained unwavering, which is, to challenge the conventional, to innovate, and to bring hope where there was once despair. All of this has been possible due to the visionary foresight of our esteemed founder, Dr. Pratap C. Reddy. His unwavering belief in the power of advanced healthcare to transform lives has been the cornerstone of Apollo's ethos. Dr. Reddy's pioneering vision to fortify the battle against cancer has not only shaped our mission, but has also ignited a beacon of hope for countless patients across the globe. Under his guidance, the Apollo Cancer Centers have become synonymous with comprehensive care, embodying a holistic approach to patient wellness and recovery. His leadership continues to propel us forward, challenging us to reach new heights in clinical excellence and compassionate care. In keeping with this ethos, our collaboration with domain partners, culminating in the introduction of the groundbreaking CAR T-cell therapy, stands as a testament to this commitment of his. It heralds a new era in the fight against B-cell malignancies and embodying our pledge to deliver the forefront of medical excellence to our partners and our patients. The pioneering efforts with CAR T-cell therapy represents not just an advancement in treatment options, but a seismic shift in the oncological care landscape. Apollo Cancer Centers has demonstrated unwavering commitment to advancing CAR T-cell therapy, achieving remarkable success with 3 commercial treatments and 5 clinical trials.
30 years ago, we set ourselves on a path, and it was the vision of our chairman, and at that time Dr. Ramesh, who helped us set up the first cancer hospital in the country, first dedicated private sector hospital in the country. But it's been an incredible journey, and I think I asked Dr. Raja, I said, Dr. Raja, how long have you been with us? And he looks very young, but he's been with us for 30 years. So, I think it's amazing that we've had the most qualified clinicians who are, globally there, who've trained, who've learned, who've imbibed the best-in-class practices anywhere in the world, and come and been part of the Apollo vision and the Apollo dream. And of course, I must talk about Dr. Revati also. She looks like a child herself, but she heads one of the largest pediatric oncology programs in the country. And I think in the private sector, it's probably the largest. So I would like to acknowledge the presence of our 2 amazing clinicians who are here with us. And of course, in the Apollo, network, we're so lucky and we feel blessed. But just in the oncology space, Harshad, how many doctors do you think we have? About 500? Much more. Yeah, between 400 to about 450. Highly qualified, super technical, amazing clinicians who every day, 24/7, battle this disease against cancer. So I think today's a day to say that we're truly blessed. Why are we all here today? Because I think at Apollo we are constantly trying to announce something or call the press and say, listen, we have done it. We don't have to do it, but why do we do it? And we do it because it's not for ourselves. It's not for us to say that, we're Apollo as a company and we from 1,000 beds today, we're 15,000 beds, or this is that is all there, and it's part of the responsibility as an institution. But we call and we talk and we discuss because we want to bring the best in class in terms of treatment to our people. The proton was almost an impossible dream. And it was only because Chairman said that Indians deserve this kind of treatment that we did that in the cancer care. We have about 15 robots which are doing robotic cancers all over the country. Revati and her team have one of the best bone marrow transplant pediatric cancer departments. But more than anything else, Dr. Raja shows his leadership. He heads the complete precision in oncology for the group. And Revati was actually telling me in 2017, July, in one of our messages in exchange, I asked her, because I just traveled abroad and come back, and said, why can't we do CAR T cells? And soon afterwards, I think Dr. Raja has worked diligently on this topic. If we are able to stand here and say, we're doing CAR T cells, we're doing precision oncology, we're doing immunotherapy, it's because he's single-minded focus from him to bring these treatments to India and try and see how can we give it to our patients. So Dr. Raja, I'd like to thank you for that. But I'll tell you why it's so important and so exciting and interesting today is that these products, normally we think that if it's high-end technology, if it's high-end drugs, medicines, therapies, it's not available in India. But we as Indians, I'm a proud Indian, but all of us as Indians have to be just so extremely proud that this is one of the true Atmanirbhar products. You all don't, I want you all to understand the importance of it. Our wonderful Prime Minister set us on a track of being proud Indians and talking about Atmanirbhar. CAR T cells, which we have used within our system, 90% of that is made in India, done in India, treated in India. So you can understand the magnitude of what has happened, is that it is not something which we've just imported from somewhere in the world and infused, while we have done a bit of that also, but these are truly made in India CARs. And I think that is what positions us as truly as pioneering institutions and as people bringing that technology.